Hi, my name is Dr. Zainab Bauchi. I am from the Department of Human Anatomy, Hamad Bello University, Zari. I am here today to take you through Anatomy 209, which is Anatomy for nursing students. And I'll be talking about Module 1, one of the topics in Module 1. Today, what I want to talk about is a general overview of what anatomy is, the terminology you're going to have to come across during the course, and hopefully this is going to help you understand better what you're going to be reading in your courseware and throughout the duration of the course. Now, that being said, anatomy is a very broad subject, it's a very interesting subject, and it's something that you can appreciate on your own. We're talking about the features of the body, the structure of the body. If I mention your arm, you have an arm, you can look at your arm, you can bend the arm, you can extend the arm, and so on and so forth. The head's there, the legs, the torso, things like that. So for the most part, what you're going to be studying in anatomy, you can visualize on your own, and you can actually appreciate what happens in your own body. Now, anatomy is the oldest medical science. It's one of the first medical sciences that was first studied. It was studied as far back as 300 BC in Egypt. The Romans also studied it. The Greeks, Hippocrates, studied anatomy. And then Aristotle as well, who's known as the father of anatomy. So if I were to ask you, what comes into your mind when you hear the word anatomy? What would you say? What would you say? What would you tell me? Anatomy, what does that bring to your mind? Some of you will tell me maybe dead bodies, bones, dissection. And you wouldn't be too far off, because when anatomy was first studied, it was studied by using dead bodies, either of humans or other animals, to look at the basic structures, the skin, the muscles, and the internal organs. But right now, anatomy has moved beyond that. Those ancestors that were studying anatomy at some point decided that they wanted to find out not only what the body was made of, but how it actually functioned. And then what happened when there was a dysfunction, when the body wasn't functioning properly. So anatomy became not only the study of structure and morphology, but also the study of function and dysfunction, or a clinical approach. So in present day, anatomy can be described as the study of structure and morphology with a clinical approach and also the clinical applications. Now, anatomy is extremely vast. Don't be deceived by people telling you that it's very, very difficult. It's vast, but it's not difficult. We have different subdivisions and a wide scope. The most prominent one is gross anatomy. Gross anatomy is about the morphology of the body, the macroscopic parts of the body, what you can visualize with the naked eye. I can tell you about the skin. I can tell you about the muscles underlying the skin. I can tell you about the internal organs. I can tell you about the bones. You can see those parts of your anatomy. And the way we study gross anatomy is basically through dissection. Although we can do live dissections with actual cadavers or dead bodies, but right now we have virtual dissections where you don't actually need a corpse or cadaver to do the dissection. But it still helps in visualizing those structures that can be seen with the naked eye. The next division or branch of anatomy is histology. Histology is a study of tissues of the body that go to making up the body. These tissues help us, or this study helps us understand the functioning of the body and how the body actually works and what happens when it's not working properly. The tissues of the body are categorized into 4 basic tissues. These tissues are categorized according to their structure and their function. So we have epithelial tissue. Epithelial tissue makes up the covering of the body and some of the organs and glands within the body. Then we have connective tissue, which provides support for the body and protection for other parts of the body. We also have muscular tissue, or muscle tissue, that's responsible for movement. Contraction and relaxation of the muscular tissue helps in moving different parts of the body and different organs within the body. And then finally, we have nervous tissue. Nervous tissue is responsible for transmission of nerve impulses, stimuli from one part of the body to another, from the brain to the spinal cord to the peripheral regions to other effector organs. So these are the 4 basic tissues that you're going to be studying in histology in another module: epithelial tissue, connective tissue, muscle tissue, and nervous tissue. Now, another branch of, so should I say a branch of histology, is cytology. Cytology explains or studies the structure and function of the cell. Now, as we all know, the cell is the basic unit of life. Everything, every living creature evolves from or develops from a single cell. So everything that that cell does is replicated millions of times in an entire organism. So cytology provides us with numerous mechanisms and technologies to be able to study what happens in that single cell, how the cell is made up, the structures within the cell, how those structures function, and then what happens if there's a problem within the cell, what's going to happen, and then eventually how we can treat or rectify those problems. Now, from cytology, we move to embryology. Excuse me. Embryology is, or can be defined basically as a study of the embryo and the fetus. Now, since development doesn't just stop at childbirth, it starts from even before fertilization. It starts from when the gametes, the sperm and the ova, actually begin to develop. It starts from that point to fertilization, to the result of fertilization, which is the zygote, how the zygote moves down the uterine tubes to the uterus, how it's implanted, and what takes place on a day-by-day basis up to the point of parturition, which is birth. Now, development goes beyond birth. It goes up to maturation, which is many, many years after childbirth. So embryology, or developmental anatomy as we call it, extends from before fertilization up to maturity of that particular organism, or in this case, the human being. We have embalming, which is another division of anatomy. Embalming is one of the oldest subdivisions. It was studied by the Egyptians. They embalmed their royalty. And from then on, the process of embalming has continually been refined and still in use today. People embalm their loved ones for burials. We embalm them for scientific purposes, for use in dissections and in examinations, and for the study of the course of anatomy. There are also other subdivisions like anthropology, which is the study of man. There's genetics, and of course there's neuroanatomy that studies the nervous system as a whole. So those are some of the subdivisions of anatomy. But for the purpose of this course, you will be looking at gross histology and embryology. Now, moving on. Before you can comprehend anatomy, you have to be able to understand the language of anatomy, or the terminology of anatomy. Anatomy has its own lexicon, it has its own language or terms that we use, and understanding them will help you appreciate the course as you move along. Most of these words that we're going to use are derived from the Greek language or from the Latin language. Some of them have their origins from animal names, some from the names of plants. So you're going to have to learn them to be able to understand what actually goes on. Now, with each topic you're going to be looking at, there'll be new terminology. But what I'm about to tell you are just the basic ones that will help you in your understanding. Now, the first thing we're going to look at are the planes of reference. Now, the planes of reference are simply lines that are used to divide the body into regions for easy description, diagnosis, and examination. We have 3 basic planes that have further subdivisions under them. The first one is a sagittal plane. The sagittal plane is a vertical plane that runs down the middle of the body vertically and divides it into right and left halves. That's the sagittal plane. There are other vertical planes, for example, the mid-sagittal plane, that divide the body still into right and left portions as you go along. Now, the next major plane is the coronal plane. The coronal plane is at a right angle to the sagittal plane. So it goes horizontally this way through the body and divides the body into anterior and posterior sections, or if you like in layman's terms, a front part and a back part. That is the coronal plane. Now, the third major plane is the transverse plane. The transverse plane runs across the body and divides it into a superior and an inferior part, or an upper and a lower part of the body. So those are the three major planes that we have. And as I said, they each have their subdivisions. We have the sagittal, we have the coronal, and then we have the transverse plane. They're used for descriptive purposes, mainly. Now, from these planes, what we have are terms for position, how to describe the human body's position in space. Normally, you could say, okay, this is up, this is down, this is front, this is back. In anatomical terms, you don't use that. For up and down, you use superior and you use inferior. Superior meaning towards the head, inferior meaning away from the head. Then you have anterior and posterior. Anterior meaning towards the front, posterior meaning towards the back. We also have medial and lateral. Medial means towards the midline of the body, towards the middle part of the body. So we can describe, for example, the heart, this region here, being medial to the lungs. This is what we have here. So the heart is towards the midline, while the lungs are further away. So the heart is medial to the lungs, while the lungs are lateral to the heart. The lungs are further away from the midline. We also have some other descriptions. For example, internal and external. When we say internal, we mean deep, something that's within. External, it's outside. For example, we can say the brain is internal to the skull. The brain is inside or underneath the skull or deep to the skull. We can say that the skin is external to the muscles. The skin is outside the muscle, or it's covering the muscles as well. So these are some of the terms that you'll be hearing in regards to position in the body. Now, there are a few other terms you'll be hearing. For example, when it comes to the hands and the feet, we have the dorsum, which is the back of the hand. We have the palmar surface, which is the palm of the hand. The same thing goes for the feet. And these are all for description, just to know what it is we're talking about, what we're referring to. Because everything is visualized. You have to know what you're looking at and where it is to be able to understand it. Now, from position, we go into movement as well. Even the movements that we use are termed differently. For example, when you bend your forearm, instead of saying you're bending the forearm, you use the word flexion. You're flexing the forearm. You're bending the forearm, you're flexing the forearm. Technically, what we're doing is you're decreasing the angle of the elbow when you flex your forearm. Now, the opposite of flexion is extension, which is straightening the limb or the part of the body. So when you straighten your forearm, you're extending the forearm and you're increasing the angle between the two limbs. So you have flexion and extension. Normally you say you're bending and you're straightening. Another term we use for movement is rotation, which is what you always know, moving around an axis. Then we have pronation and supination. Now, in anatomy, there's a normal positioning of the body. The body is supposed to be in a supine position. The body is lying upright with the head facing upwards. The palms also facing upwards. This is supination. So when you have a supine forearm, that means you have turned your thumb to the lateral position and it's facing upwards. Your palm is facing upwards. This is supine. When you say pronation, you're turning the palm downwards and your thumb is moving medially and facing towards the body. You have pronated your forearm, or you're using pronation to move that arm. There are other terms, such as elevation. For example, you're elevating your shoulders, you're lifting your shoulders. There's depression, as in you're depressing the shoulders. We have protrusion, you're putting out your chin, for example, and retrusion as you pull it back in. Then there's a particular movement called circumduction. Circumduction is all about moving around all of these movements. You're using flexion, extension, abduction, adduction, rotation to move around the entire axis of that joint. And then two movements that I forgot to mention, abduction and adduction. When we say adduction, you're moving a limb toward the midline of the body. For example, you have your forearm stretched out. When you move it toward your torso, you're adducting the arm. You're bringing it closer to the midline of the body. When you extend the arm, you're using abduction. You've taken it away from the body. So you abduct, and then you adduct. Abduct away from the body, adduct closer to the body. So these are terms that we use to describe how the body is moving, whether it's a live body or a dead body, but how movements are described in human anatomy. And then there are special cases or special terms, special organs or regions that use particular terms for movement. For example, in the palm and the feet, we use dorsiflexion and palmaflexion. Dorsiflexion simply means flexing the hand upward, while palmar extension or palmaflexion means bending the palm downward. The same happens for the feet. And then there are two other terms called eversion and inversion. Eversion is moving away from the midline with the sole of the foot, while inversion is moving towards the midline with the sole of the foot. So these are special terms that we use in anatomy. Now hopefully, you're going to be hearing them throughout the course. Hopefully they'll assist you in localizing what you're looking at and understanding what it is you're looking at. Because for the most part, anatomy is a descriptive science. We're going to describe what it is you're seeing and why it's functioning the way it's functioning. So these terms are supposed to enable you to understand what's being told. If you're told that the humerus was abducted and then laterally rotated, you know what we're talking about. The humerus was moved away from the body and then turned laterally. So you have to know these terms before you can actually understand what's going on in the anatomy course. Now, in other modules, you'll be looking at all of these things in relation to the body alimentary system. You have the skeletal system, the muscular system, nervous system, reproductive system, and so many other systems. But the take-home point here is understand these terms, be able to relate them to your own body, and I assure you, it'll make things so much easier when you're finally going through your coursework. That being said, I thank you for listening and have a nice day.